My initial training was in primary care, and then I did a fellowship in sports medicine. Right out of fellowship, I knew I wanted to do something in the regenerative world. The Regenexx difference is that you've got a network of people that are all trying to do the same thing. You've got folks that are involved in research, and we're bringing specialists of different subspecialties to help grow the practice of regenerative medicine, and the Regenexx physicians are those that are right there developing these new techniques.
The field of regenerative medicine is growing very quickly, and Regenexx does provide the most superior technology and offers the highest level of training.
People come to see me for Regenexx treatments because they say they're following the science. Regenexx seems to be the only provider in the space that's doing constant research and constantly reinventing themselves and bringing out new and better products.
One of the most remarkable recent stories that I have is a gentleman that had a motor vehicle accident and endured a cervical spine injury, a neck injury. He ended up having a fusion of 2 levels. He actually did well from the fusion initially, but then his pain creeped in and he actually developed significant weakness in his arm. I ended up doing a treatment of his neck using our Regenexx platelet lysate into the epidural space surrounding the nerves. I ended up doing a few of those treatments, and then I started using that platelet lysate and platelet core plasma into the muscles themselves. He has regained function of his arm, and he has regained his muscle strength. Even his muscles have filled in. So he's really had a turnaround in his life, especially being a right-handed individual. He is now able to use his right arm.
I think that you really have to look at a patient comprehensively to really understand why certain areas are failing. That may not be the problem in and of itself. The examination that we do now is very comprehensive, from doing a comprehensive clinical examination, which is musculoskeletal based, to looking at diagnostic studies with the patient and explaining the results of those diagnostic studies, to talking about regenerative treatments, talking about outcomes, talking about risks, side effects. It's very extensive.
When you become a Regenexx physician and you're treating patients with Regenexx procedures, you can customize the treatment according to what each patient needs, which most doctors can't do.
The thing about being a part of Regenexx is that it's a tried and true process. They've been doing it the longest time. They have the most research. It made sense that this is probably the best, and to give the best to patients is what I wanted to do. So for me, it was a no-brainer.
I've been doing regenerative medicine for about 6 years and have been doing it very successfully, but I was finding that I was getting a little bit lost in the field of regenerative medicine and trying to figure out what is good medicine and what is essentially like hype coming from the sales reps. And so going with Regenexx, I felt like it was a very research-driven, outcomes-driven, very high-quality group to join, where I knew I was joining the best and would be practicing with the best.
I think for any physician that is wanting to get into this field, it's an exciting field. We're learning new things all the time, but Regenexx has the resources to help any physician, whether they're just starting or that they've been into it for a while, to get the best available tools to help their patients on a daily basis.
Being able to have a flexible lab platform is extremely different from using a bedside centrifuge per se, not only from a scientific standpoint, but just from a patient outcome standpoint.
Our flexible lab platform has a lot of capacity for us to really custom tailor treatments towards particular conditions. And then on top of that, we have a strong community of really intelligent, like-minded physicians that really are bouncing ideas off of each other and innovating in the space of regenerative medicine.
Regenexx makes sense. It's easy to understand why they do what they do, and it's like many things. Once you know the 11 secret herbs and spices, you understand why the chicken tastes so good. And it's something that's very simple. It's just anyone could do it, and if you administer it properly and give it to the patient the right way, the results are going to be fantastic. The patients love it, and the patients keep on coming back to see me for more.